Yes, Commissioner Ivy, can you hear us?
Yep, I'm ready. All right, Alice, are you recording?
Yes, she is now recording.
Okay, fantastic. We'll go ahead and get started today. Appreciate everybody attending and participating in today's Board of Equalization and Commission meetings. We do have a Board of Equalization meeting that we have to start off with today. We had one item on that agenda. Commissioner Lee, any questions on that?
Nope.
I'll entertain a motion.
I'll make a motion that the Equalization Access Assessor approve the report as stated number 1 on our agenda.
I will suspend the rules and second that. All those in favor, please say aye. Aye.
Aye.
I will carry 2-0. One final motion.
Motion to adjourn.
I'll second. All those in favor, please say aye.
Aye.
Aye. That will carry 2-0. We stand adjourned. We'll now go ahead and move directly into our
Let's see,
commission
we're going to
meeting.
change the recording really quick.
Mm-hmm.
All right. Good to go.
Okay. Fantastic. We'll go ahead and welcome again everybody to our Board of Commissioners meeting. We appreciate your attendance and participation. As is traditional, we can go ahead and start our meeting with a prayer reading or thought and followed by the Pledge of Allegiance. Commissioner Lee, I will turn the moment to you if there's anyone in the room present who would like to lead us in that prayer reading or thought or the pledge.
It looks like they're all raising their hands, so it's your choice. Any volunteers for? We got a pledge back here. We got a prayer too. Thank you.
All right, fantastic. You'll just come to the podium and state your name and lead us in that prayer.
Our Father in heaven, we are very grateful for this opportunity that we have to get together and discuss the needs of the county. We're grateful for the fortune that we have, our fortunate circumstances, and we bless that and pray that the virus will continue to be mitigated. We're mindful of those who are struggling with natural disasters at this point. So bless them and watch over them and help us to know the needs of others and help them. We're grateful for all of our many blessings and faith in the name of Jesus.
Amen.
Amen.
Can someone make sure that the microphone at the podium is turned on?
That's great. Okay, would you all repeat the pledge with me? I pledge allegiance to the flag
To the
United
flag
States of
of
America,
the United States of America
and to the
and
republic
to the republic
for which it stands,
for which it stands,
under
one
God,
nation,
indivisible,
indivisible,
liberty and justice
with
for all.
liberty and justice for all. All right. Thank you very much to everyone for your participation in that. Certainly appreciate it. We do have one public hearing to conduct today. Today's public hearing is in regard to the temporary reduction in Commissioner Ainge's 2020 annual salary because of time spent at direct military training. I would go ahead and entertain a motion to open that public hearing.
I move that we open the public hearing as published on our agenda.
I will be suspending the rules for this meeting so I can second that motion. All those in favor of opening the public hearing, please say aye. Aye.
Aye.
Okay, we will now go ahead and turn the time to the public. Are there any public comments in regard to this matter? And again, any public members online who would like to participate and add comment to this matter during the public hearing? Hearing and seeing no public comment, I'd entertain a motion to close the hearing.
So moved.
I'll second that. I have a motion and a second to close the public hearing. All those in favor, please say aye.
Aye.
Aye. I'll pass 2-0. We'll now go through the process of building our agenda. All items will be considered moved to consent unless held for further discussion. It is my understanding that we do have on our consent agenda, regular agenda item number 1 is our Employee of the Month. So I would anticipate that we would hold that so that we can recognize those individuals. Looking down through there, I did not have any additional items on consent that I had any more questions on that hadn't been answered. Commissioner Lee, did you have any?
Yes, if we could hold number 15 and number 18, 19, and 20. And then it's been asked that we continue number 21. There was a bidding problem that needed to be. That was from Richard Nelson,
Mm-hmm.
and that's what I have on the consent.
Okay, sounds great. I'm definitely good with continuing 21. Moving to our regular agenda, I had regular agenda item number 29 that I believe we need to hold so that we can pass it based on the findings that it's in the public interest to do so, to waive those fees. Were there any other items on the regular agenda from you, Commissioner Lee?
Yes, I wouldn't mind leaving this number 24 on consent if it's agreed to that the final version is the one that we are approving. And
Yeah.
And if we could hold number 26, and that's all I have.
Okay, fantastic. I am good with those two. We'll now go ahead and turn some time for the Employee of the Month recognition.
Okay, we've got 2 of them. These are no secrets because they're published and we did a little recognition beforehand. The first one is Ben Banoy. Where are you at, Ben? There you are. Come on up. Come on up. And since we have 2, if it's all right, I'm not going to read everything that they put on there. They have a lot of flowery stuff, so way to go. But I'm just going to kind of paraphrase both of them. But the second one does have more pages than you do. I'll just tell you that right now. Okay. The current, and especially coming from a law office, which is usually very wordy, right?
Exactly.
Okay. The current pandemic created an administrative and regulatory and legal quagmire of questions and issues. During this time, an exceptional employee and public servant of the county has risen to the challenge and gone above and beyond the normal duties and responsibilities of his position to provide critical assistance to the county. Ben Banoy, a deputy county attorney, is genuinely impressive. We would like to make a few observations about his character and performance in general and how he has helped the county during this challenging time. First, Ben is hardworking and dedicated to providing the highest level of professionalism, and it continues on and lists a whole bunch of stuff on there. Second, in addition to the work he provides to his departments, he is also ready to help his colleagues and strive to improve the atmosphere of the office. As one colleague writes, Ben is a team player. He has a wonderful working relationship with each attorney and staff member in our office. He represents Utah County with the highest sense of dignity. He certainly builds and lifts those around him. Ben is always willing to do whatever he is asked to do. Nothing was too mundane or complicated. So, and then it goes on. Another coworker has some other, and then third, He helps elevate the legal discussion of important issues by looking at issues critically and then defending the position that he believes the county should take. I think Ben would defend to the ground. I think Ben would defend to the ground what he thinks is right. He's not afraid to speak or argue his opinion, which I think is great and exhibits confidence in his approach. Fourth, he is an important facilitator helping work with the county commissioners, departments, directors, and public in crafting solutions to problems with complicated legal, economical, political consequences. And it continues on. And then last down here it says, Ben is a tremendous asset to the civil division of the county attorney's office and the county as a whole, and his contribution to its success. He continuously delivers high-quality work product, meets and exceeds deadlines, and assists coworkers at every opportunity. We believe Ben Vanoy to be an ideal candidate for his outstanding service to the county and deserving of recognition as Employee of the Month. And lots of people signed it at the bottom here. Everyone in probably the civil division signed it. So this, you should make sure and show this when you do your next review, right? Your review.
Exactly.
But thank you. Well done. You get a chance to speak.
I just want to say I'm truly grateful to work for the county and with my peers, my colleagues. But I do want to say that this goes out to the health department. They've truly been amazing. They've done a miraculous job during this whole crisis. And I wish they could all be up here with me because they truly deserve it as well. So thank you.
All right, thank you. Are we doing pictures? I don't know if anybody's here for that. Oh, we are? Okay.
And just a reminder to all those who are participating in this meeting via phone or remotely to please mute your devices unless you're speaking.
All right. The second employee is Andrea Beefus. Multiple pages. Maybe I shouldn't say this over and over, or else it's going to turn into a whole bunch. But it is out of great respect that we nominate Andrea Beefus, a GIS GIS Systems Analyst for the Utah County Employee of the Month Award. Andrea is employed in Utah County just over a year. In that time, she has become a friend to all and one of the most well-respected employees throughout the county. Soon after Andrea began working at the county, a need surfaced for a better way to show the elections results public-facing online. She spent countless hours working with the elections department to create an interactive online dashboard that allowed for voting results in real time. Also, drop boxes were placed throughout the county to collect voting ballots. Once again, there was a need and it was met. An application for the rovers was created where they would capture the data at pickup, and then it would be captured again when they were dropped off to be counted. This application was greatly increased the accuracy of the ballots tracking, assuring the safety of their ballots. This briefly touches the work that went into this project, which is still improving. Andrea and the elections team were asked to present this project at the 2020 ESRIC Users Conference in San Diego, California, which is fantastic. I have to get to this one. Peter Quitner, because I first time I met Andrea was out at the EOC, and she showed me what she put together out there, and I'll read some of the stuff here and maybe make some comments to it. I've been working with Andrea Beefus on multiple emergency management projects for the last year. Because of our great working relationship, we requested the support from her as she stood up our Emergency Operations Center to manage the COVID-19 crisis in Utah County. We identified an extreme need to develop some custom solutions to help track, and streamline our efforts. This was a challenging task for many reasons. Andrea was willing, eager, and more than able to come in to develop these solutions as a working member of our Emergency Operations Center. Andrea has a great ability to think outside the box, to translate her ability and knowledge with GIS into quickly deploying solutions for real-world situations or crisis. Her solutions made a dramatic impact not only to Utah County, but the region and state as well. And I have to echo that. What she developed there was top secret, wasn't it, to a certain extent? You can't look at it. We couldn't look at it. Well, I mean, I got to look at it, but then they had to wipe my memory afterwards or something. I don't know what they did. They put this thing on my head and said some temperature thing. And it goes on and on. It talks about several other applications have been created by Andrea, including mosquito abatement dashboard, deep point tracking, community develop online editing, civil beneficiary surveys countywide. So there was a lot of things that Andrea has done here in the short time that you've been here, with the county, and we really appreciate what you have done. There's more. There's some coworkers that have put some great comments on here, and thank you so much for the work that you've done in helping Utah County become more open, transparent, and on top of, especially during this crisis that we have. So thank you.
So it's weird wearing a mask because I'm smiling the whole time. So thank you. It really was a surprise to receive this, but it was a huge honor. I got to work with so many amazing departments, and our county is great. So thank you.
Thank you.
Thank you so much. And Bill, if you've got, when you're done with pictures, just let me know.
Okay, Commissioner, we're back.
Sounds great. Congratulations to everybody, and thank you so much for your dedication and hard work on these items. We'll now go ahead and start working down through our agenda. First up, we have from our consent agenda, item number 15. Commissioner Lee, you had a question.
Yeah. There was, these documents on this one kind of got uploaded a little late, so for 15, 18, 19, and 20. And so, Richard, if you could kind of walk us down through them.
Sure.
That would be very helpful.
Do apologize for the lateness of those getting there. This is part of our EWP project, which is the after-fire mitigation for the Pole Creek and Bald Mountain fires that happened almost 2 years ago. And this is the emergency watershed program. And being a federal program, it doesn't move very fast. So we're quite a ways down the road. One of the things that we actually had the bid opening on these on Monday. And then yesterday we spent kind of going through those bids, making sure that everything was up to par on things. A couple of them have city components as well. I'll talk about those. That's on 18 and 19 as we get down to those. The funds that are for these projects actually come through the NRCS. We had an overall project of almost $10 million that was awarded through NRCS, to which the local entities have a 25% match that's required. There was some money that was awarded through the state of Utah last year, about $2.1 million that would help with offset that 25% match. As we've looked at these projects as a whole, we're coming in actually under budget. We're about 8.1 million is where we are, and that's putting some assumptions in the one that needs to be rebid for DSR 1. We do have interlocal agreements in place with the cities that are affected by these different ones that we're doing in conjunction with them, that obligates them to pay their portion of the local match and any of the overage costs for design work. That's all worked into those interlocal agreements that were signed a year or so ago, year and a half ago. So with these, we actually have, and if you want, I can go through them each individually, or we can kind of talk in general, whichever you guys would prefer.
No, I don't need to go through them. I just wanted to hear that, and I think that it's probably, I feel comfortable making a motion on all of them to approve, subject to, our getting the money from the
From the
federal,
state.
from the state,
The-
from the state, I mean, from the federal government through the state, right?
Right, and the 2.1 was from the state legislature.
Oh, okay, that's right, right.
And then also on 18 and 19, they would be subject to, 18 would be subject to Payson City approval, and 19 to the City of Elk Ridge approval.
So
because-
again, all that, but also with the cities
Yep.
as well.
Yep, and that'll happen at their city council meetings next week, is the plan.
Okay. Are you comfortable with that?
Yeah, that sounds great to me.
All right, I'll make a motion then that we approve and authorize the signing, as stated in number 15, 18, 19, and 20 on our published consent agenda, with the stipulation that these are agreed to conditional, upon the funding that will come from the state, and also, in agreement that the cities also agree.
I will second that. All those in favor of approval of consent agenda items numbers 15, 18, 19, and 20 with the notations, please say aye. Aye.
Aye?
That will carry 2-0. Next up, we have regular agenda item number 26. Commissioner Lee, question?
20. Yes, 26. In looking at this, not sergeant anymore, now it's lieutenant, right? Lieutenant. Couple questions I have. We just went through a process of looking at charges that we charge, of $75 per hour, that we adopted and went through. This one here it's 56. I understand that it's a total cap of $23,000, and I understand that kind of fills up that time slot, and I get that, but I'm concerned that if our $75 per hour rate is correct, then why are we going to 56? And also I think, and probably the second question is that there's on a patrol basis, there's significant drive, which is mileage. Is there a mileage difference on there too, or is this more of a flat rate?
Yeah, it's not actual mileage, but there are additional things that are added to it. So the $56 that you have on there, Forest Service requires some kind of a number, so it's not actual 56. It's billed in a true cost. So in other words, if you have a regular deputy that makes a certain amount of money, it's what his pay is, plus the overtime. Same thing as with a sergeant. So it's that plus whatever we add in there for the benefits and vehicle and everything else. So it's not actually $56 an hour that's billed to. It's billed in true actual cost for what it costs for the deputy to be out there.
So could we change it to reflect that? So that 56 is confusing.
I understand that the way it was done in the past, we asked about that. The Forest Service requires some kind of set number for them to go with. And I don't completely understand it myself, but they understand we've been billing them this same way for years for the true and actual cost.
Yeah. So we could put the 75 in there and it would still wind up being the actual cost.
Yes.
I would prefer doing that just to be consistent with what we've done in the past because earlier we approved, Central Utah Water Project or ratified theirs at 75. And so it seems inconsistent if we don't do that. So, I'd be in favor of putting the 75 in there and then billing the actual cost.
I would have to check back with them and get their approval on that, and that just, takes more time. If that's what you want to do, though, then I start that process with them as well.
Okay. I would personally prefer doing that, just to be consistent with what we're doing across the board. Otherwise, it almost appears like we're charging the federal government less than what we charge a neighboring city or other entities.
I believe the number you're looking at is the $74, which was our contract agreement was
Yes,
changed to this year.
Exactly.
Okay, I can go back with them and let them know that, and try to get that changed on there, and then we can come back and do this again if that's what you'd like to do.
So we can continue this.
Yeah, I think it makes sense to continue that. And for me, part of the thought process is let's just change it now so as these continue to come up, we don't have the problem reoccurring. It's just reflective of our new rate anytime we have these arise in the future.
Okay. All right, anything else you need from me?
That was it.
Thank you.
Okay, I'll entertain that motion.
I'll make a motion that we continue item number 26 for 2 weeks.
I will second that. All those in favor of continuing, please say aye.
Aye.
Aye. That will carry 2-0. Next up, we have regular agenda item number 29. As I mentioned, in my understanding, we need to hold this one so that we can approve it with findings that public good outweighs the cost of the fee, if we so deem.
Okay. Let me get there.
Any additional thoughts there, Commissioner Lee?
No, I'm looking at this. Oh, yes. Okay. Yeah, fair enough. So let me make a motion. Let me make a motion that we approve the request as stated in number 25, stating the findings that is in the best interest of the public or the citizens of Utah County, state of Utah. What was that wording? Yeah, help me out there, Rob.
It's number 29.
Right.
It's that the benefit outweighs the burden, I guess. A benefit to the public outweighs the fee, the cost of the fee.
That's my motion.
Okay, I will second that. We have a motion and a second to approve 29 as stated. All those in favor, please say aye.
Aye.
Aye. That will carry 2-0. Okay, we will now look to setting our closed meetings. I did have a note that we needed, if I remember correct, 34, and I forgot the other one. Rob?
37?
So this is Rob Moore, Utah County Attorney's Office. 34, if you'll set that for today. 35 and 36 can be stricken, as far as I understand. And 37, if you could set that closed session for Tuesday, September 1st at 3 p.m. here in this room. We appreciate that.
Okay.
Perfect.
And I haven't looked at my calendar. That was coordinated with
Yes.
my, okay.
That was a
fair
better
enough.
day for you, actually, according to Brian.
Ready for motions?
I am.
I'll make a motion that we strike agenda item number 35 and 36.
Second. I have a motion and a second to strike regular agenda items, number 35 and 36. All those in favor, please say aye.
Aye.
Aye. That will
Make-
carry 2-0.
I'll make a motion that we approve and set a date, time, and location for a closed meeting to discuss the character, professional competence as stated in number 34 for today's date at this location following our regular meetings.
I will second that. I have a motion and a second to approve, set the meeting as stated in regular agenda item number 34. All those in favor, please say aye.
Aye.
Aye. That will carry 2-0.
I'll make a motion that we approve and set a date, time, and location for a closed meeting for a strategy session to discuss the reasonable or pending imminent litigation for Tuesday, September 1st, 2020 at 3 p.m. At this location.
I will second that. I have a motion and a second to set the meeting as described in regular agenda item number 37 for the noted date. All those in favor, please say aye.
Aye.
Aye. That will carry 2-0. We will now turn some time over, I believe, to Ralph Clegg, who will be presenting a work session on the Health Department's annual report for 2019. Ralph.
Yes, thank you, Commissioner. This is a little different. It's almost a virtual, but I don't know. Commissioner Lee, do you have your copy with you? I'll just give you a copy.
You know, I don't have my copy with me. I have left it up at the office. Thank you.
Commissioner Ivy can find it online if you.
Yeah. Yeah, Commissioner Ivy, you can find it online on our website if you want to look at it while you're there.
Yeah, it's on your website. Yep, we're good.
Okay, good. You know, we were kind of expecting to do this next week, but this is good. It doesn't give me time to prepare a PowerPoint so that you can suffer death by PowerPoint. So this is probably good. I'll just go through a little bit of this in conjunction with your time and respectful of that. And just maybe highlight one item on each of the pages or close to each of the pages. But, you know, if the page, the front cover is page 1. If you go over to page 3, where there's service stories, I'll just note that we've put in some service stories this year as we've gotten comments from some of those that we work with closely. On page 4, I'll just go down to health promotion and focus on that just a little bit, because that talks a little bit about the incident command system, which I just confirmed with Peter. He always is offering the commission an opportunity to be trained in that system. But the incident command system is what we operate under as we face a pandemic or an emergency situation. You know, fortunately, in 2019, we did a lot of preparation on our planning and have received an accreditation from the National Association of County and City Health Officials called Public Health Ready. It takes about a year to do that. There's a lot of, you have to meet certain standards in planning, preparedness planning, workforce development, and also in real life demonstrations. So you have to test your plan and do some exercises with your plan. And so while that focus of that will be in 2020 report, because that's when we actually got the award, all the work was done in 2019 in essence. So as you go look down under health promotion there, about midway through, it talks about you know, having to create a training and exercise plan, which I mentioned, to respond to emergencies in a uniform fashion. We had to have at least 80% of our staff trained in the incident command system. We were able to get everybody trained in our incident command system, which is really good, so that they understand what their role is in an emergency. And we also set it up where we had kind of slacked off a little bit on people as they come in, or their new employees, making sure they get that training as well, which was not taking place. And so that's one of the gaps we were able to close. And due to that, it's made our pandemic response you know, much improved over what it might have been if we would have had some of those holes. Even though in any pandemic, you still find out you have a few gaps to close. So. On page 5, I'll just read this one about senior companions, 3/4 of the page of the way down the page. It says, I think the senior companion literally saved my life when it was referred to me through Wasatch Mental Health to ease social isolation and loneliness. I've been volunteering for more than 5 years and is now the reason I get out of bed. And so that's one of the benefits of the senior companion program, as well as the foster grandparent program. Help some of our seniors get the opportunity to serve in the community and help. You know, unfortunately, one of the things we're dealing with now is with the pandemic, some of these folks are not able to function in those same capacities for a time, but our staff is working on alternatives for them that will hopefully help them with some of the things that they're struggling with because of not being able to serve in the same way. And I'll mention something on that a little later too. On page 6, let me just highlight our new website. The new website has really improved to public access and navigability. You know, with that website now, you know, phones and tablets, the website works well with those. It's mobile friendly. And so that's kind of saved us as we've tried to get information out about the pandemic and our dashboard. And as mentioned, Andrea Beefus, very well deserved. She's helped us with the dashboard information on that website with the continual updates, which before, with the old website, it would have taken us weeks to get some of that information out. So we're very appreciative of that. That's been a real success for us. Again, while it was launched in 2020, most of the work that went into that was done in 2019. You go over to the next page, page 7, just that picture down in the lower right-hand corner. Again, one of the tests that we did for the PPHR and something we're doing to prepare as a drive-through flu clinic. And this was at Lone Peak High School to test how we can give emergency vaccination capacities. Testing that with flu just in case, trying to prepare for ways that if there is a COVID vaccine, that we can give the COVID vaccine on more of a mass basis as well. Some have interpreted when we talk about mass immunizations that means mandatory immunizations, which is not the case. Mass immunizations is just our ability to inoculate as many people as possible in as short as time as possible. There's nothing mandatory about any immunization. So, on the next page, page 8, mosquito abatement. If you look at that graph in the lower corner there, you can see that in 2019, that was probably our second highest year for mosquitoes for a number of years. Not as bad as 2011, but more than any other year since 2003. And so our mosquito abatement folks looked for new ways to try to help reduce those high counts, including the use of drone service now, which has been very successful. And so if we were to look at 2020, realizing we're not through the whole season yet, our numbers are down from what they were in 2019, fortunately. So next page, page 9, vital records. What I'll point out there is that the statistics right at the top about birth and death certificates. And what I wanted to point out is as you look at that, you see how much is being done in our American Fork office compared to what's being done in Provo. And you can see that the demand for services in the North County continues to grow and increase. And, you can see that they've done just almost half as many as Provo in birth certificates and more than half in death certificates, which is, particularly death certificates, very much appreciated by the mortuaries who get those certificates in most cases for families. So, and then, of course, just in the middle there, leading causes of death, you can see that in a relative manner, you can see that still heart disease is a major concern. Not just in Utah County, but the state and even nationwide. Cancer also a very important concern. It'll be interesting that next year, I'm guessing we'll see COVID statistics on a chart like this as well. So on the next page, and again, stop me if there's any questions, either commissioners. I've got most of my staff here, key staff here. They're just anxious and wanting to get up here and answer questions, I can assure you. So, on the next page, page 10 down toward the bottom, make note about our immunization compliance. We do get good compliance from our citizens, ultimately with the school-age children. It's going to be a little more difficult this year because for so long nobody was going out and going to the doctor's office for this or coming into the health department. Mm-hmm. So there's been a little bit of a cushion given to get those immunizations, and we're expecting, and we've been setting up clinics to deal with the increased flow from what we expect there. On page 11, you'll see the reportable infectious
Can I ask you one question?
diseases.
Since you asked on the leading causes of death,
Yeah.
On your website, if you hover over, will it give you exact numbers on the bar chart? No, it won't. Okay.
You probably wouldn't because it's in a PDF format, I'm guessing, isn't it? Yeah, but if you want some actual numbers, I can get those to you.
I'm just wondering, do you have any idea on the suicide rate for 2020 where we're at compared to last year?
Well, as far as a rate, I'm not sure, but
Well, maybe
the good news, if there is any good news in death, Our suicide rate has gone down somewhat from where it was, a couple of years ago. Part of that, I think, is education on opioids.
Right.
And getting naloxone into the hands of a lot of folks, including law enforcement and other first responders. So the good news is that suicide is not as high as the rate is not as high as it has been. The bad news is that it's still something that we struggle with as a society. Okay, on page 11, Family and Personal Health Services, our public health nursing. Just focusing for a moment on reportable infectious diseases. One of the things that happened, I think it was 2019, unfortunately, we've seen large increases in chlamydia cases in our county and the state and, well, really throughout the country. And it came to where there were so many cases we could no longer do case or contact tracing for chlamydia cases. We had to rely on the case to help us with that. Fortunately, the treatment is successful and probably pretty easily obtained if they'll go into their physician. And so, but in dropping that, we were able now to spend more time with a couple of sexually transmitted illnesses that have more negative outcomes, and that's gonorrhea and syphilis. As you see, those rates are also increasing. But now we were able to spend a little more time with those and try to get those as controlled as possible in our community. So, of course, syphilis is a spirochete infection and a little more difficult to treat, has some negative outcomes, but even though we have had quite a few more cases than we've had in the past, it's something we can deal with because of the dropping the contact tracing for chlamydia. So on the next page, but you can see also several of the diseases we track. There's over 88 reportable conditions that we have to track, and that I don't know if that includes COVID-19 now or not, but that was added this really this year. So. On the next page, page 12, just the picture there in the lower left-hand corner, again with our public health information officer getting her flu shot as we were promoting the drive-through clinic for Lone Peak High School. You see her along with one of our epi nurses there. Again, as we test things, we find out we had issues. And good thing we did test. We found out some of our generators weren't working. We had to get them fixed. So that they will work when we need them. The next page, page 13, I'll just highlight the one thing right at the bottom. That's just to note that with the South County office, we're also expanding to do things like car seat checks and other types of things that as we can schedule and count on people to come in to make those a little more available to our clients and our citizens as well. So we continue to try to do that and make the services we have as available to our constituency as we can. On page 14, health promotion, the environmental health promotion, just focus on the asthma. As you look there, our asthma blog, which is done by Andrea Jensen, is still been rated by the medical news today as one of the 10 best asthma blogs in the country. Very successful information that goes out through that blog to help people as they deal with asthma, which is a growing issue for our citizenry. And if you look at the asthma home visitation program, you can see that those who are participating in that, it's generally lower income folks that we try to help out there. We have significant decreases in missed working days, doctor's visits, unplanned doctor's visits, hospitalizations, et cetera, from the efforts of our staff in those areas. And that'll cover health promotion on page 15 as well. Again, I can't cover everything, but just a few things here to wrap up. Environmental health on page 16. Our household hazardous waste day has always been a very successful program. And you can see the amount of waste that was collected that could have contaminated our landfills here in Utah County, as we were able to divert that off and have it disposed of in a bit more appropriate fashion. Unfortunately, this year we had to cancel it due to COVID, and so fortunately, though, our district landfills and our district transfer stations stepped up and still offered the same service to our communities, particularly with electronic waste, which is becomes very difficult sometimes to deal with. So, and they could dispose of it for a certain time for free, just like a collection day. So, and that's maybe the model we move to in the future as we get that more rolled out. We'll see how that goes. On page 17 on WIC, let me just highlight the portion on the left-hand column there down toward the bottom where it says EWIC coming soon. This is preparing to roll out EWIC. What EWIC is rather than go in with a voucher that has to be cashed and redeemed by the store, it's going to be an electronic banking card, kind of like a debit card. And, a variety of advantages for using that. It's going to be much more efficient, much more convenient for our clients. Currently with a voucher, if you're allowed so many pounds of banana and you go an ounce over that, you have to take a banana off or take it off, very inconvenient for clients. This will allow that, so if they just go a little over, they can pay the difference. And it's going to be a much better system for those who take advantage of WIC. And as always, we've been participating in the Utah County Fair, other than this year, with a breastfeeding station that's been very well accepted by those who attend the fair. And we thank our WIC folks for doing that. Page 18, the senior volunteer programs, foster grandparents. Again, a lot going on there as we try to get school started. 2 of our 3 districts are going to allow the the foster grandparents back into the schools. I think that's right, isn't it, Sherry? Yeah, okay. But with some strict precautions, which is natural, since that's a very sensitive population, particularly COVID, and we know children can not be symptomatic for COVID, and so with precautions that'll be very important. But it's good to have the seniors back. They're anxious. The volunteers are anxious to be able to be back out and serving. For senior companions, we're initiating things that can do that more virtually a little bit, still give some contact, even though it's not in person. But Friends of Public Health, we do generally in the commission meeting, with the exception of perhaps this year we'll find another way of doing that. And then on the back page, bottom half, you can see all of the things we have to do because of the federal law, which we often refer to as Obamacare, where we have to put our statement about non-discrimination in about 15 different languages. So that's on any major publication that we have. So, I don't know, any questions, concerns?
No. Comment though. Thank you, Ralph. It's a pleasure working with you and your staff on very sensitive issues in a lot of ways, and life and death and all in between. And in looking through this magazine and seeing it, I actually really do appreciate the levity to a certain extent that you put into there. I was just noticing on page 12 with the dinosaur getting that massive shot.
Yeah.
And I think I think that's great. I saw a post.
And then the dinosaur screaming.
Yeah, of course. Screaming, less like what my kids do when they need to get a shot. Yeah, I saw a post on Facebook and it just showed this picture. Somebody was driving and it said COVID-19 testing, and it had an arrow and it said in the rear, and underneath it said, "What? I thought it was in the nose." So.
Yeah.
Anyway,
Yeah, we're living in an interesting time right now, don't we? With a lot going on, a lot of controversy, a lot of different feelings, very sincere feelings on all sides
thank you.
of the issue. So, thank you, Commissioner.
Ralph, I do have just probably one question for you, and
Okay.
I'll proceed it with a thought. Earlier today, I was in the Central Utah Water Conservancy District meeting, and we had the conversation about the fact we're in probably one of the worst droughts we've ever been in.
Yeah.
But nobody talks about that because of COVID. Outside of the COVID pandemic, what is the greatest, public health risk we're currently facing that nobody's talking about?
Well, certainly the opioid crisis has not gone away, but it's not receiving. Yeah, right. It's not receiving any attention right now, is it? Even many of the other things that we do, such as the harmful algal blooms, that goes unnoticed. Even though we still struggle with some of those things at Utah Lake and maybe some other areas, but yeah, nobody's talking much about diabetes and some of the other things that we're faced with our chronic diseases. And fortunately, we've got great staff that are continuing their efforts in those areas, even though we had to back off on some of them to deal with some of the things we had to deal with the pandemic. But we're bringing on new staff to kind of deal with that, so some of our staff can get back to their normal community activities. And hopefully it'll help with all of that, Commissioner. I think that's a very good point you bring out, because we've certainly experienced that with immunizations. And so we hope to catch back up on some of those things. Thank you, Commissioners.
Thank you so much. Appreciate all your work.
Thank you.
Okay, with the conclusion of the presentation from the Health Department, we'll now turn time to any general public comment. The mic is now open for anyone online or who is there in person for general public comment. And hearing and seeing none, we will go ahead then and move into our closed session. And thank everybody for their participation.